Hi friends, welcome to classes by Lab Doctor. In today's class, let us understand in brief about the acute phase reactants. Okay, so acute phase is the phase of inflammation. Whenever there is inflammation, whenever there is infection, or whenever there is a tissue damage, these reactants or the proteins are produced by our body to fight against the infectious agent or to reduce the tissue damage. Okay, so that is why this is acute phase reactants. Acute inflammation, basically when there is any kind of an infection, tissue damage, these proteins are produced. So you have different types of acute phase reactants. Okay, you have C-reactive protein. You might have heard about C-reactive protein. Any kind of an inflammation, doctors order C-reactive protein. So this is an acute phase reactant. Your fibrinogen, it is an acute phase reactant. And your serum amyloid A, fibrinonectin, your ferritin, angiotensinogen, haptoglobulin, all these are your acute phase reactants which are increased during your inflammation. We will study why some are increased and why some factors like transferrin, transthyretin, your alpha 2 glycoprotein, they are reduced during acute phase reactant during inflammation. But these are all called as the acute phase reactant. These are the ones which are altered during a inflammation. So what happens during an inflammation? So whenever there is any kind of an inflammatory stimulus, okay, there could be a tissue injury, there could be an accident, there could be a bacterial infection, a lung infection, a pneumonia, or there could be a heat stress, or there was a muscle breakdown, there was a psychological stress, whatever could be the inflammatory stimulus, the body sends its first line of agents. Those are the monocytes, the macrophages. Okay, and they release the cytokines or like interleukin 1, interleukin 6. Interleukins, they are nothing but the communicating channels or the communicating substances between the WBCs. Inter is in between, leukins is the leukocytes or the WBC. तो WBCs के अंदर जो बातचीत होता है वो है ये substance interleukin. So these interleukin, tumor growth factor, interferon gamma, all these what they will do, they will stimulate the production of these acute phase reactants, and also they produce the systemic response. So your interleukin 6, what it will do? It will increase the C-reactive protein. It will increase the fibrinogen, haptoglobulin, complement components, ceruloplasmin, amyloid A. All these are increased. And albumin, your transferrin, all these will be reduced. And the body produces certain systemic response. Like there is increase in your ACTH, cortisol, so there is fever. The patient feels sick. Patients will have, if there is a muscle breakdown, his creatinine kinase might be increased. In hematology, you will see that there is increased WBC count, there is leukocytosis, thrombocytosis, there might be anemia. Okay, and biochemically your iron will be reduced, your zinc can be reduced, your copper, etc. increases. So this is what happens during an inflammation. So these acute phase reactants, I've told you, they are nothing but proteins. And proteins are produced, maximum, they are produced in the liver. So liver is the one which produces these proteins. But what happens? Sometimes the liver produces more of this reactant, and sometimes it will try to preserve. It will say that, you know, I don't want to waste my protein. So some of the proteins it will reduce, and some proteins it will increase. But not only the liver, small amount of this acute phase reactant can be produced by the epithelial cells, your endothelial cells, and connective tissues also. Like you have your endothelial cells, they produce your serum amyloid A, plasminogen activator. Majority is produced in the liver, but some amount can be produced in the endothelial cells. Your epithelial cells and connective tissues can produce your amyloid, fibrinogen, etc. So that is where your acute phase reactants are produced. So you can see here all the acute phase reactants here, and these are produced by the liver, because liver is the main source of protein production. So the interleukin 6 stimulates the production of these acute phase reactants, and whenever there is inflammation, there will be systemic symptoms like redness, pain, heat, swelling, edema, etc. Okay, so you will see that now a person is having a prick. There is an injury. So the prick has led the bacteria to go inside the skin surface. So what happens? Here you can see the blood vessels which are below. There are capillaries. So once these capillaries are stimulated, you will see that the phagocytes, they start moving to this area. Okay, so there is vasodilation, there is endothelial leakage, and also these phagocytes, they release your acute phase reactants also, because I have told you the interleukins, when the communicating substance between the WBCs are produced, the interleukins, they stimulate the liver to produce your acute phase reactants. So the acute phase reactants are produced. They will also help in the leakage of these WBCs. They will cause vasodilatation. They allow the phagocytes to migrate to that area. So that is why they are increasing during your inflammation. So you will see that these phagocytes will go, they will eat this bacteria up. There will be fibrinogen which is produced. Fibrinogen, what it will do, it will form a clot, so that it will not allow the bacteria to spread, it will not allow the infection to spread. So fibrinogen is increased during your inflammation. And your antithrombin, the one which is telling the thrombin to be reduced, that is decreased, because we do not want the clot to go away. We want the clot to trap this bacteria. That is why fibrinogen will be increased during your inflammation, whereas antithrombin will be reduced. Okay. So that is how the body responds to this inflammation, by producing your acute phase reactants. So you can see here the neutrophils. Here you can see the fibrinogen which is formed. So they will take the platelets. They will trap this bacteria here, and they will form the clot here. That is why fibrinogen is increased during your acute phase. Okay. So I've told you that your C-reactive protein, we will study about C-reactive protein in our later classes. So this is also a protein. It is the one which is increased during your inflammation. Fibrinogen, I have told you, it will trap the bacteria. It will not allow the bacteria to move. So that is why it is increased. Your ferritin will increase, and your negative phase reactants, albumin is going to decrease. Your transferrin is going to decrease. Your iron is going to decrease. Okay. So amyloid, I have also told you amyloid is also an acute phase reactant. Okay, so this, what happens whenever there is an inflammation, infection, or an injury, large amount of this amyloids will be produced. They will be taken by these HDL lipoproteins to transport the lipids, and they will help in the repair of the tissues and pathogen elimination. That is why this, during inflammation, this amyloid is also produced, and that is the reason why this is also included in the acute phase reactants. Your ferritin. So what happens whenever there is inflammation, these cytokines will stimulate the liver to increase the production of ferritin. Okay, ferritin is also a protein. So this ferritin, what it will do, it will sequester, it will store the iron, limiting its availability to the microbes and immune cells. So what it will do, when the ferritin, the binding protein, is increased, it will trap the iron. It will not allow the microbes, the bacteria, the other tissues to take the iron. That is why what happens, iron will be reduced, ferritin will be increased. So if you see the iron levels in inflammation, they will be reduced, and the level of ferritin will increase, because it will see that it will go and catch hold of the iron molecules, and it will see that the iron is not available to the bacteria and the other cells. So ferritin is increased. Albumin. Albumin is a protein which is produced by the liver. Now what happens? This liver, when it knows that there is a kind of an inflammation, there is an increased rate of albumin degradation and utilization by the tissue. So the albumin level starts going down. Okay, because inflammation will increase the permeability of the vessels, and when there is permeability, the albumin will leak from the vascular compartment and it will come into the interstitial space. This leads to edema. So that is why we see rubor, calor, dolor, or the swelling. Why? Because there is edema, and edema has occurred because there was leakage of albumin, and because the albumin has leaked outside, the level of albumin goes down in the blood. And also liver also decreases the synthesis of this albumin. It will try to safeguard the albumin. It will reduce the overutilization of albumin. So albumin will reduce during your inflammation. So you can see here during your inflammation, you can see the C-reactive protein, serum amyloid A, haptoglobulin, fibrinogen, how they will raise and how they are coming down slowly. So certain parameters or the acute phase reactants are high, like your Mannan-binding protein, your haptoglobulin, your CRP, your ceruloplasmin, complements, your alpha-1 antitrypsin, ferritin, fibrinogen, amyloid, all these are high. Your transferrin is the one which is transferring the iron, so that is reduced. Iron itself is reduced. Antithrombin, we do not want the clot to go away, so antithrombin is reduced. Albumin is reduced. These were few of the acute phase reactants. So whenever there is an inflammation, doctors order these acute phase reactants to see how your body is responding to treatment. Do you actually have an inflammation, and how the patient is responding? To find out, we do this acute phase reactants. Usually we do this, your CRP, your ferritin, your fibrinogen, your procalcitonin, etc. Okay, so ESR and CRP, these are there is some difference between these two. ESR actually it is a sediment, erythrocyte sedimentation rate, which we see in the lab. Okay, so it is not something, it's not a protein or something which is produced by the liver, whereas your these acute phase reactants are the ones which the liver produces, the body produces. That is why these come under your acute phase reactant, and we do not include the ESR under these acute phase reactants. So in the next class we will start studying about each of these parameters, whichever we do commonly in the laboratories. But this was in brief about the acute phase reactants. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.